Hello and welcome to our special report on the escalating crisis in the Democratic Republic of Congo. In recent weeks, the M23 rebel group has intensified its offensive in eastern Congo, capturing key territories, including areas surrounding the strategic city of Goma. While the military clashes dominate headlines, a silent crisis is unfolding, one that is hitting the region's most vulnerable the hardest. Since the beginning of January, over 2,900 people have been killed, and thousands more have been injured. Hospitals in Goma are overwhelmed, facing severe shortages of medical supplies and blood. Medical staff are pleading for blood donations, as the influx of wounded civilians and soldiers continues to rise daily. Displacement camps are swelling beyond capacity. Families, many of whom fled with nothing but the clothes on their backs, are seeking refuge in overcrowded shelters, churches, and makeshift tents. The United Nations estimates that hundreds of thousands have been displaced since the fighting escalated, with many lacking access to clean water, food, and basic healthcare. Children are among the hardest hit. Many have been separated from their families in the chaos, and humanitarian organizations warn of rising malnutrition and disease outbreaks in the camps. Now, for more on the situation on the ground, we turn to our journalist Raymond Jules reporting from Goma.
We're coming to you from Goma, where the situation is deteriorating rapidly as M23 rebels continue their offensive against government forces. The sounds of heavy gunfire and explosions are now a constant backdrop, with fighting reported just kilometers from the city center. Thousands of civilians are fleeing their homes, desperate to escape the violence. Families with small children are carrying what little they can, moving towards overcrowded displacement camps on the outskirts of Goma. Conditions in these camps are dire. There's little access to food, clean water is scarce, and shelters are packed far beyond their capacity. Many are sleeping on the ground, exposed to the elements, with no idea when or if they can return home. Hospitals in Goma are struggling to cope with the surge of wounded. Medical staff are overwhelmed, supplies are running dangerously low, and doctors are pleading for urgent blood donations. Many of the injured are civilians, victims of stray bullets and shelling. Some hospitals have been forced to perform surgeries without basic equipment, and healthcare workers warn that they may soon have to turn people away if more aid doesn't arrive. In the displacement camps, fears are mounting over the spread of disease. The overcrowded conditions and lack of sanitation are a breeding ground for illness, and aid workers are struggling to keep up. Malnutrition is on the rise, especially among children, and there are growing reports of families being separated in the chaos of the evacuation. The United Nations has expressed deep concern over the escalating violence and the worsening humanitarian crisis. UN officials are calling for an immediate ceasefire and are urging both the Congolese government and the M23 rebels to allow humanitarian organizations access to those in need. But despite these calls, the fighting shows no signs of slowing down. Peace talks have stalled, and the rebels appear determined to hold their ground. For the people of Goma, the fear isn't just of violence, it's the uncertainty of what comes next. Many here feel abandoned by the international community, left to fend for themselves as the conflict closes in. The question on everyone's mind: when will this nightmare end? Reporting from Goma, Raymond Jules.
Thank you, Raymond, for that detailed report. Despite calls from African leaders and the international community, the Congolese government has been reluctant to negotiate directly with the M23 rebels, further complicating efforts to secure peace. As the conflict rages on, the people of eastern Congo face an uncertain future. Their resilience in the face of such hardship is a stark reminder of the urgent need for peace and humanitarian support. Stay tuned for more updates as we continue to cover this developing story. You were with me, Lisa Annabelle.